Hi everybody, I'm April Cummings and we're going to be talking about an interesting subject today with Dr. Cesar Perez. He is from UHealth, University of Miami Health System. Thank you so much for joining us today.
Thank you very much. Nice to be here.
So when we talk about HPV normally, we're so conditioned right now to think about cervical cancer, for example. But you're here to tell us that there's more going on than that.
Yes, HPV, so it's the human papilloma virus, and it's a virus that is associated with cervical cancer. And we know that we have pre-malignant lesions, so we can detect lesions that are precancerous lesions in the cervix with pap smears. And we know for the last 40 years we have been doing pap smears to try to catch it early and try to prevent cervical cancer. The truth is that HPV is associated with 6 different cancers in total, including penile cancer, vulval cancer, anal cancer, cervical cancer, and also the head and neck cancer, so cancer to the oropharynx. Right? And the problem with cancers from the head and neck that are associated with HPV is that they don't have these pre-malignant lesions that we can screen, so we can prevent the cancer. And that's something we have been, over the last 20 years, cervical cancer has been decreasing in incidence because we're usually catching early the pre-malignant lesions. However, we found that head and neck cancer that is associated with it has actually been increasing in incidence for the last 30 years. And that's when we actually discovered the association 12 years ago with the HPV virus.
So that makes for a challenge, certainly.
It is a challenge and it is a problem because it's becoming an epidemic. And in UHealth, we have an extensive preventive program in trying not only to try to detect cancer early, but also our preventive trying to vaccinate and extend our vaccination throughout Florida. You know, we have South Florida has a territory of 6 million, and our population that we have to cover is at least half of that. Head and neck cancer in 2020, so next year, it will actually surpass in incidence, HPV-related head and neck cancer will surpass cervical cancer in incidence next year. So obviously it's becoming an epidemic now. And the only preventive measure we'll actually have is the HPV vaccine.
So at the core, the idea is that really people need to know that there's not just one reason to have this vaccine.
There's not just one reason, and also we have to know that usually we focus the HPV relationship with women. But truly, the HPV-related head and neck cancer is more prevalent in men. So it's also a problem for women, of course, but the whole HPV compendium of associated cancers that in US is calculated to be 35,000 cases every year of HPV-related cancers. And of those 35,000 patients, at least 1/3 of them will die from their disease, even in this developed country. Truly, we can potentially prevent in US at least 10,000 deaths per year of HPV-related cancers, of which some of them are cervical cancer, but not most of them. Many other, including anal cancer, penile cancer, and head and neck cancer, are actually not what we usually think about when we think about HPV.
So that is really your core message, is that there's this other aspect that we're not paying attention to, but is an equally important reason to get the vaccine.
Yeah, and equally important and actually increasing now in incidence. Actually, the trend is going on. We have an HPV epidemic, and HPV has been one of the extensive studies that we have been doing, and one of the focus that we have at UHealth, trying to focus and study the virus. And obviously, when patients develop the cancer, we are in the forefront of developing immunotherapies to try to cure more patients, right? And one of the many reasons why we have been NCI designated now, and we're one of 2 programs that is NCI designated, by the National Cancer Institute in the state of Florida, and the only province of Florida, because we have been focusing in the treatment for the HPV, but now we are looking back and we have to focus more on the prevention of the disease, and we're hoping that by 2030, at least in US, 80% of the young adults will have been vaccinated, and that's a WHO goal. So we're hoping to reach that goal with these programs.
Thank you so much for your time. I really appreciate that.
Thank you so much. Thank you for your interview. It has been a pleasure.